Hello, my name is Dr. James Golding, and you're watching A Natural Health Care Alternative. This show is dedicated to your health, welfare, and well-being. I would like for you to stay transfixed on the television at this time and do not touch your beeper. You may get yourself a natural snack, but you will not need a pencil or paper at this time because you will be able to get a free copy of this video, and you'll watch for that at the end of our show. Tonight's program is on facial rejuvenation, and we are going to perform a facelift using acupuncture. Also, we're going to talk about different aspects of skin, keeping your skin healthy and intact. And we're going to start right now. One of the things that you need to do most to keep your skin healthy is to drink enough water. Americans in general do not drink enough water, and you're going to increase your water intake. That doesn't mean that if you drink too much water that you're going to make your skin any more healthier, but you have to have an adequate water intake. One of the reasons for facial deterioration to occur the most is the effect of the sun and on our skin. We have a tenfold increase in the past 50 years of malignant melanoma in this country and many other forms of basal skin cancer due to inappropriate coverage of our skin when we're outside. What needs to be done is that when you're in the sun, you need to put the sunscreen on, and one of the most serious grievances towards your health and welfare is that most skin problems are caused not just by the sun, but by parents. And what I mean by that is that you need to take care of your children and make sure that their skin is covered with SPF 15 and which should be waterproof when they go outside, starting from the time that they're very young. Because unless they start these habits, as they grow up and you're not with them, they're not going to take care of their skin appropriately unless they do that. So what happens is that what they find out with people that have skin disease and skin cancer later, the most common thing that they trace back was the fact that these people had serious burns and sunburns when they were a kid, practically every one. So if you prevent that, you're cutting down on a lot of disease and a lot of premature aging to the skin as one grows older. What they find is that the effect of the damage on the skin is cumulative, meaning it gets more and more for each serious exposure that you have to the sun. And there's not too much you can do to make it go backwards, so you have to make sure that you protect yourself from the sun. The other thing is to protect your sun when yourself in the winter equally as much as when you're doing winter sports. And the reasoning for that is that you're not just getting the sun and its effect on your skin, but you're getting the reflection of the sun off of the snow. And this can cause some serious damage to your face. One of the reasons for healthy skin and a healthy non-aging face, a lot of it has to do with hereditary. So some people are blessed with a greater ability to just be looking healthy in the skin than others. Also, people that have diseases of the skin and are more susceptible to sun-oriented problems are people that have either blonde hair or red hair, have blue eyes, and don't have much pigment to their skin and have a history of burning easy. These people really need to take care of themselves much better. One other way in which you can prevent wrinkling, premature wrinkling of the face is to sleep on your back. And using a cervical pillow makes it so that you're not applying pressure on your face. What they find also is using a Dacron pillow cover, because it has a slidey surface, makes it so that the skin of your face doesn't bunch up and can frequently cut down on premature aging and wrinkling of the face. Women have more difficulty with maintaining a facial structure without wrinkling and lines than men do. And the reason for that is that men's skin is thicker. Also, it has much more oil glands than women's skin has. And as a result, men have a 5 to 10 year difference in the way in which their skin ages as opposed to women. The other side of the coin is that men usually don't take as good care of themselves as women do, and so that may cause premature aging of their face too. The other thing that needs to be understood is one of the most common things that causes premature aging of the skin is smoking. If you smoke, you better stop smoking. The skin is a exogenous excretory organ, and not just the fact that it holds our body, holds our body together. It's one way in which your body gets rid of toxins or poisons. So what happens is the air that you breathe in is getting inspired and expired, and part of the way in which you're getting rid of toxins or poisons is through the skin. You're urinating and defecating them out. But the skin itself and the health of the skin is intimately related to the health of the lungs. And what you can't do is you can't be smoking, because smoking, and what they find, the average cigarette has about 154 different chemicals in it that they use in the processing of cigarettes. So you're getting a whole bunch of bad elements in there, not just cancer-causing agents, but those poisons have to come out somewhere, and they usually come out in your skin. Now, there's two major components to what causes skin to wrinkle or age prematurely. Number one, we have the cells of our skin are originally very thick and very supple. And the cells of our skin, as we grow older, become more loose. They don't have the elasticity, and then they start to become more fragile, and then lines occur. The other thing is that the underlying connective tissue that we have underneath our skin gradually gets looser, and it's no longer resilient. And this can also bring on premature lines to occur. So the skin is related, and the aging of the skin is related to lines that we get on on your face. The underlying musculature is what causes us to get aging, creases in our face or wrinkles in our face. So the skin is related to lines. The wrinkles are related to the underlying musculature of the face. And in a moment, we're going to go over some anatomy once we take a little bit more care of the basics. When it comes to nutrition and well-being, as far as your skin is concerned, making sure that you're having as natural a diet as you can is going to be beneficial for your skin, because your body shines through your skin. As far as supplements to take, they've done a lot of studies on supplements, and they find that taking an overabundance of nutrients, as far as supplements go, is not going to make your skin much more healthier than what it would be normally. But if you have a vitamin deficiency, it's going to cause you a lot of problems. So the good thing to do is take a good natural vitamin, and also, we'd hear a lot about the fat-soluble vitamins, vitamin E. Vitamin E is good for the skin. Applying it topically, they don't find helps to retard aging, but taking up to 400 to 600 international units of vitamin E is beneficial. They don't find that taking vitamin A and vitamin D is all that beneficial, because we get a lot of that in their diet. But what I have found, and what research indicates, is that if supplementally you take water-soluble vitamin A from lemongrass oil, which is super emulsified, and you take that internally, what they find is that vitamin permeates the epithelial layer of the skin and provides a barrier, and also helps to hold moisture in. Moisture is so vital to the health and welfare of your skin that that's the number one thing that you need to do. So every day after you wash your face, you're going to apply one form of moisturizer or another, because the whole goal is to not provide the moisture, but to create a barrier in which the moisture is not being left from the natural state of your skin. They've done a tremendous amount of studies that indicate that the amount that you spend on your moisturizer, regretfully, is not the key. And there's a whole market out there making billions of dollars on moisturizers that don't do too much more than things that you could buy at the regular drugstore. What I tell people is to get a moisturizer that is reasonably priced and effective for your skin, meaning making sure that it does the job, but that it reacts well with your skin. If you have to spend a little bit extra to obtain that, then do so. If you don't, then you don't have to be concerned about it. Another thing to do to maintain to avoid, if you want to maintain your facial structure, is do not go onto fad diets. Do not go into rapid weight loss programs that because this causes the underlying fat in your face. When that is lost very quickly and your body doesn't have a chance to redesign itself, it will cause a lot of premature wrinkling and lines of the face, which are very difficult to correct afterwards. Okay? Now, before we do our demonstration of the acupuncture facelift tonight, we're going to go over a few basics in regards to facial anatomy. Now, how this whole thing with the muscles takes place is that the muscles of the face, as we grow older, underneath gradually draw tighter and tighter and lose they draw tighter and they lose their ability to relax and expand and contract as much as they used to. So what happens is that the tighter the muscles get, the more we get wrinkles. The other aspect can be flaccidity of the muscles, and this frequently occurs in this region because the muscles are very thin and they become weakened as time goes on, and we have a tendency of getting jowls into here. So weakened muscles can also cause a gradual deterioration of the look of our face. So it's important for us at this time to understand some of the anatomy associated with the face and facial structure. The muscle that overlays this region here is known as the platysmus. This is a large sheet muscle here, and the natural tendency for this to be tight helps us to maintain your normal structure in here. I call this the Kirk Douglas muscle. Doing that exercise is helpful for maintaining strong posture in there. There's a great book that was written about 30 years ago by a dermatologist called Dr. Anna Asland, and it's called Facelift by Exercise. It can be bought. It's not normally carried in like Borders and books, but it can be ordered. It's a good book for everyone to own. So we have our other muscles of interest here today are the orbicularis ori. This is a large circular muscle that goes around the mouth. Weakness and tension in this area creates laugh lines and smile lines that a lot of people are concerned about. We have the orbicularis oculi. That is a large rounded musculature that comes from all the way across the brow and underneath. Weaknesses of that cause abnormal lines in and around the facial area. We have the occipitofrontalis muscle. That's a large sheet muscle that comes from all the way from our temporal region all the way to the base of the occiput in the back. That causes us to get a lot of lines throughout the course of this region. We have the zygomaticus major and minor muscles, which also cause us to get lines into this region. So weakness or dysfunction of these muscle groups are what we're going to attempt to do a correction on here today. The other thing that I'd like to point out before we begin is that this is a chart of the acupuncture meridians of the body. Acupuncture is a tool of balance. Acupuncture is a Chinese technique that has been developed over the course of the past 3,000 years. And what we find is that certain points that we're going to stick acupuncture needles in today that are distal, meaning further away from the face, are going to have influence over the tension and tightness of the facial muscles, and we'll be demonstrating that here tonight. So our discussion isn't to go off into Chinese medicine and meridian-based acupuncture theory tonight, but we will be utilizing these regions for application as far as a tool of treatment goes. Another thing that I'd like to demonstrate here today is that this is a picture, a somatic representation of the ear. And what they found out is that certain areas in the ear have reflexes within your brain to the vagus nerve, which influences different regions of the body and different regions of the face in different manners. So we are going to be applying acupuncture needles in very specific points in the ears that are going to influence the tonicity of the muscles in and around the face. Of primary importance to facelift acupuncture is that we are going to use acupuncture points throughout the course of the head and face that are traditional Chinese acupuncture points, and also points that are known to be control points. These are points that control the tension in and around the underlying musculature. There's two processes that are going to take place here tonight. One is sedation. We are going to take the muscles that are too tight and constricted, and we're going to release them. We're going to allow for them to relax, so this underlying constriction thing lets go. Then we're going to apply a process of tonification. We are going to normalize the pull of all of the underlying facial musculature using not only regular meridian-based acupuncture and trigger point acupuncture, but we're also going to use electroacupuncture today, and that is going to stimulate the normal pull of the muscles. The other thing that we're going to use today is the helium neon acupuncture laser. This acupuncture laser is used to eliminate lines and small creases that are in the face. How that does that is by using a cold laser light along the creases. What it does, those photons stimulate a normalizing effect on the tissue and allow for repair of those crease lines. So we're going to be using auricular medicine. We're going to be using traditional Chinese meridian-based medicine, acupuncture points. We're going to be using facial acupuncture, electroacupuncture, and we're then going to be following up our treatment today by using the laser to eliminate fine lines.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within. Introducing the all-new Enclave. It's a minivan to the max, with features like remote control sliding rear doors, 150 cable channels, a full sky view roof, temperature-controlled cup holders, and the 6-point navigation system. It's the minivan for families on the go.
It's my birthday! Oh, it's so pretty! Oh, I told you! Don't be bringing that weak stuff in here! Yeah! Who's the man? Who's the man?
Exercised lately?
With us here this evening as my patient is Janet Barston, a longtime Bridgewater, New Jersey resident who runs a successful accounting firm along with her husband. Janet, thank you for being part of the show today.
Thank you.
And now, let's begin. What I've done at this time is that I've taken care of the meridian-based acupuncture component of our acupuncture facelift here today. And those points are large intestine 4. These are very strong acupuncture points in the web of the thumb that influence all of the symptomatology that goes on to the head. Down in this region, we have needled liver 3. These are points down by the feet that allow for the smooth flow of qi and energy in the body. Also, gallbladder 42, These points allow for release of the facial musculature on the lateral portions of the temporal areas of the head. With that now taken care of, the patient would normally rest for about 5 minutes. And now we're going to start the next part of our project. What I've just completed at this time was the facial acupuncture control points for sedating the facial musculature. In this region, we are taking care of all of the muscles that deal with the occipitofrontalis region. We're dealing with the main musculature that deals with the lateral compartment of the face, the zygomatic major and minor muscles. Now we've also dealt with the control points for the orbicularis oculi. What we're going to do now is I'm going to do acupuncture points in and around the area of the eye that will allow for the small creases associated around the eye to relax, and the control points for the orbicularis oculi. What I've now just completed is using these needles with the fine blue tips, we are needling along into the crevasses of the fine lines of the face and also dealing with the control points in and around the orbicularis oculi. What I'm going to be demonstrating next is the electroacupuncture component of our treatment here today. This area is all to relax and sedate the involved regions. Now, tonification next. What we're demonstrating now is the re-education of the musculature around the orbicularis ori muscle group. What you'll see is that as the muscles get re-educated, it's almost like the person's pursing, or as it comes into play. There'll be a relaxation of the current, and then what happens is it'll be like a 3-second burst to re-educate the musculature in the area. A person will usually see a change in the lines or creases in the involved areas using this technique in approximately 3 to 5 treatments. Depending on the age, the condition of a person's skin, and not necessarily the age of the patient, depends on how much treatment is necessary throughout the whole course of the treatment involved. Sometimes a regime can be up to 15 treatments. The treatments are usually rendered at a frequency of twice a week for usually the first 8 to 10 treatments. Treatment takes about an hour, and also the treatment needs to be boosted by having a treatment done at about 3 to 4 month intervals to normalize the effect of the acupuncture face lift. Results vary from individual to individual. However, favorable results are seen in a reasonable period of time. Also, there's no inherent dangers to an acupuncture facelift, as there is with something similar to getting a Botox injection, which involves injecting small amounts of poisons into the muscles that actually paralyze your facial muscles, allowing them to relax so that the creases or wrinkles disappear. That, once again, is something that needs to be done intermittently in anywhere from 3 to 4 or 5 month intervals so that the patient maintains their normalcy of that correction. The great thing about an acupuncture rejuvenation or acupuncture facelift is that even though it's invasive by using acupuncture needles, it is not anywhere near either the costs associated with having a facelift done or the severity of the procedure done as far as intervention on a medical level. One last area we're going to show you is the re-education of the zygomatic major and minor musculature in the elimination of laugh lines. What we're seeing here is the normalization of the normal neuromuscular pull of the facial musculature and the lateral aspect. This component of our treatment, the electroacupuncture side of it, takes roughly about 3 to 4 minutes for each of the muscle groups involved. The majority of it is a more passive process that deals with the sedation, which takes a longer period of time, roughly about 35 minutes, along with the other meridian-based acupuncture treatments. The last part of our treatment here today is the use of the acupuncture helium neon laser. This laser is used on the smaller lines, not the wrinkles, but the smaller lines like the crow's feet and the smaller laugh lines. They can be smoothed out and eliminated by using the acupuncture laser. Depending on how involved the lines are, or how many lines that there are in the given patient, depends how long the interaction of this treatment is going to be. Sometimes it can take 10 or 15 minutes to accomplish the task at hand. The most common areas that that the laser needs to be used is in the crow's feet, or in and around the eyes. This process normalizes the resiliency of the tissue, increases the blood and fluid flow to the involved area, and stimulates a localized healing response of the soft tissue. With this portion of our treatment completed, the patient will be done for the office visit for that day, given home instructions on care to utilize, and dietary as well as lifestyle guidelines that will help to make them feel better and maintain the normalcy of facial structure. I always recommend following the treatment that the patient, after they get done washing their face, rinses their face with ice water for about 20 seconds to close the pores. And this could be done by everyone, but following treatment, that's very indicated. Also, I recommend that the patient take 3,000 milligrams of vitamin C complex with rutin and bioflavonoids. These help in soft and connective tissue repair, add to the resiliency of the underlying connective tissue, and are natural antioxidants that help to pull poisons out of the skin layers. For natural health care alternatives, I'm Dr. James Golding, and we'll see you next time.